Rengel. I'm a student nurse practitioner. I'm going to be performing a head-to-toe examination on you today. Okay, so I'm going to wash my hands. What's your name and date of birth?
Alain Bernal, 10/12/1995.
Alright, now I'm going to start with the skin. I'm going to inspect the patient's skin. So there's no redness, I don't see no rashes, no lesions. It's good skin color. And I'm going to palpate the skin. Okay, so the skin is cool, dry, it's not moist. It's good skin turgor, no indurations felt. Any tenderness?
No.
And no masses are felt. Moving on to the head. So this head is normocephalic, atraumatic, symmetrical. Gonna inspect the scalp. So it's hair distribution is even, no redness, no rashes, no lesions. Gonna palpate the scalp. Hair is fine and smooth. No masses felt. Any tenderness?
No.
Very good. Gonna inspect the face. Now it's symmetrical. There's no redness, no lesions, no swelling. Gonna palpate the temporal arteries. Any tenderness?
No.
And it's normal pulsation 2+. Next, I'm gonna test for cranial nerve number 7, your facial nerve. So I want you to show your teeth. Can you show your teeth for me? Smile, puff your cheeks, and raise your eyebrows for me. Okay, so cranial nerve number 7 is intact, which is good. Now moving on to the eyes. So first I'm gonna test your vision, which is also testing cranial nerve number 2, your optic nerve. So use a Rosenbaum chart to use glasses.
Yes.
Okay, so I'm gonna hold it about 14 inches from your face. Cover the right eye for me, and then read this line for me.
LTFPH.
Okay, cover the other eye. Read it backwards.
HPFTL.
Very good. Now with both eyes.
LTFPH.
Okay, visual acuity 20/20 bilaterally, and cranial nerve number 2, optic nerve is intact. Next, I'm gonna inspect your eyes. So just take off your glasses for a bit. I'm gonna inspect the eyebrows. So they're symmetrical, no redness, no rashes, no lesions. Moving on to the eyelids, the pupillar fissures are symmetrical, no redness, no lesions. Eyelashes are present with normal direction. The medial lateral cantuses are symmetrical, no redness, no rashes. Lateral sac and glands are symmetrical, no redness, no discharge. And moving on to the conjunctiva, the bulbar and papillar conjunctiva are symmetrical, but with no redness. There's no discharge, no foreign bodies. And the sclera is white, no redness, no jaundice. The cornea has no opacities, iris is well defined. So now I'm gonna look inside your eye, looking at the pupil. Gonna shine a light into each eye. The pupils are round and reactive, equal to light. They're about 3 millimeters in size. Next, I'm gonna test for direct and consensual papillary reflex. Gonna shine a light into your left pupil. This is for direct, light reflex is seen in the left pupil. Next, for consensual, light reflex is seen in the right pupil. Next, I'm gonna test for direct into the right pupil. Light reflex is seen in the right pupil. Now for consensual, shining a light into the right pupil. Light reflex is seen in the left pupil. Very good. Next, I'm test for accommodation and convergence. So I want you to fixate in the wall behind me and just look at it. And when I tell you to, you're gonna look at the pen, okay? So look at the wall, pupils are dilated. Now look at the pen. And the pupils constrict and the eyes converge, which is normal. Next, I'm gonna test for your visual field of confrontation. So I want you to fixate on my nose and cover the right eye for me. Fixate on, then you tell me how many fingers I'm holding up.
1, 2,
Okay, cover the other eye for me. Fixate on my nose.
1, 1.
Very good. Visual fields are intact. Next, I'm gonna test for extraocular movements. I just want you to follow with your eyes my headlight. Okay, very good. No nystagmus, no lid drooping. And cranial nerve number 3, 4, 6 are intact. Next, I'm gonna look inside your eyes, okay?
Okay.
Now just open the door for a bit. I'm gonna turn off the lights. Gonna set the diopter to 0. So now I'm gonna look into your right eye first. Gonna stabilize your head with my hands. Gonna use my right eye. Red light reflex is visualized. Gonna go in. Okay, so the optic disc is round, no redness, well defined, sharp. Cutis ratio 0.3, no papilledema, no AV reflex is seen, then go in. After the disc is round, well defined, no redness, cut disc ratio 0.3, no papilla edema, no retinal lesions, no EV nicking, and no vessel seen around the macula. Very good. Eyes look good. Turn on the lights. Okay, moving on to the nose. I'm going to test for patency of the nose, so I'm going to cover one nostril, breathe in, out. Going to cover the other nostril, breathe in, out. So the nares are patent bilaterally. Next, I'm going to test your sense of smell, which is also cranial nerve number 1, the olfactory nerve. So I want you to close your eyes. I'm going to cover one nostril, and then I'll ask you to smell this. Smell this, Steph. What smell is that?
Coffee.
Very good. Now I'm going to cover this nostril. Smell this, please. What smell is that?
Cinnamon.
Very good. So if you open your eyes, cranial nerve number 1 is intact, and smell is intact. I'm going to palpate the nose. Any tenderness?
No.
No mass is felt. Now I'm going to look inside each nostril now. Going to put the tip of the nose upward. Going to look into the right nostril first. Nasal mucosa is pink, moist. There's no redness, no discharge, no perforation, no ulcer, septum is midline, and no deviation, and no nasal polyps. Check the other nostril now. Tip the nose upward. Nasal mucosa is pink, moist, no redness, no lesions, no perforations, septum is midline, no deviation, and no nasal polyps seen. Very good. I'm going to palpate the maxillary and frontal sinuses. Going to palpate the maxillary and the frontal. Any tenderness?
No.
No mass is felt. Now moving on to the mouth. Outside the mouth, there's no redness, no lesions, no rashes, no swelling. Lips are moist, no cracking. Now I'm going to look inside the mouth now. Then you see your teeth first. Yes, good dentation. The gums are pink, no redness, no ulcers. Now just say So open your mouth for me. So the tongue is midline, no ulcers, no white patches, no redness, no lesions. And the soft and hard palates are also pink, moist, no redness, no ulcers, no lesions. Next, I'm going to test for cranial nerves number 9 and 10, glossopharyngeal and vagus. So first I'm going to depress your tongue, stick your tongue out. Depress the tongue and uvula rise in midline. And now I'm test for gag reflex. Okay, it might be a little uncomfortable. Okay, gag reflex is present. Now open your mouth again. Underneath the tongue is also pink, moist, no ulcers, no lesions. Now I'm going to check your tonsils. Say out for me. Tonsils are 2+, but no erythema and no exudate. Very good. You can close your mouth now. And now I want to test for cranial nerve number 12, the hypoglossal nerve. So can you stick your tongue out? So patient's able to stick it in midline, move to left and right. And now can you say light, tight, dynamite for me?
Light, tight, dynamite.
Okay, cranial nerve number 12 is intact. Now moving on to the ears. First, I'm going to test your sense of hearing, which is cranial nerve number 8, the acoustic nerve. So I want you to cover this here. I'm going to go behind you. I'm going to whisper some words to you. You repeat it back to me. Okay?
Okay. 1, 2, 3.
Okay, cover this here.
ABC.
Very good. Hearing is intact. Cranial nerve number 8 is intact. Next, gonna perform Weber test on you. I'm gonna strike this tuning fork. Gonna place it right here on your head. You tell me you're hearing one or both ears.
Both.
Okay, so Weber test is midline. Next, I'm gonna perform rhyme. Gonna strike the tuning fork. Place it on your mastoid process. You tell me when the sound stops. Okay.
It stopped.
Now you tell me when it stops again. Right by your ear.
It stopped.
Very good. Now I'm gonna test the other ear. Tell me when it stops.
It stopped.
Now tell me when it stops.
It stopped.
Okay, so air conduction is greater than bone conduction bilaterally, which is normal. Gonna inspect the ears, the auricles. So they're symmetrical, no redness, no rashes, no lesions. Gonna palpate the mastoid process. Any tenderness?
No.
No mass is felt. Gonna palpate the ear. Any tenderness? Palpating the tragus.
No.
No mass mask is felt. Now I'm gonna look inside of each ear. I'm gonna start with the right ear first, pulling the oracle upwards and backwards. I'm gonna inspect the canal first, right ear canal. So cerumen is present, but there's no redness, no scarring, no lesions, no erythema. The condylar reflex is in the 5 o'clock position. The tympanic membranes are pearly gray in color. No erythema, no perforation. The tympanic membrane between the malleus is above the tympanic, is between the tympanic membrane and the incus, and pars falcata is above the malleoral folds. Now moving on to the left ear, going oracle upwards and backwards. Gonna look at the canal. Cerumen is present, but there's no redness, no lesions, no scarring. The condylar reflex is seen in the 7 o'clock position. The malleus is between the tympanic membrane and the incus. The pars falcata is above the malleoral folds. The tympanic membranes are pearly gray in color, no erythema, and no perforation. Okay, so it looks good. Now moving on to the neck. Can you just lift your neck to the ceiling for a bit? So neck is symmetrical, no redness, no rashes, no swelling. Next I'm gonna palpate your lymph nodes. So I'm gonna palpate the preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical chain, deep cervical chain, and posterior cervical chain, and supraclavicular chain. Any tenderness?
No.
No mass is felt. Okay, now I'm going to palpate the trachea. So I'm just using one finger. Trachea is midline. No mass is felt. Any tenderness?
No.
Very good. Now I'm going to palpate the thyroid gland between the cricoid cartilage and above the suprasternal notch. Okay, use one finger. Any tenderness?
No.
No mass is felt, and thyroid is midline. Okay, now moving on to the chest. Can you take your shirt off for me? I'm going to give you a drape. I'm going to start with the posterior chest, the back of your chest, so turn this way. Cover you here. Okay, so I'm just going to look at the chest. So it's symmetrical, no redness, no rashes, no lesions, no retraction seen, and respiratory rate is normal. Next, I'm going to palpate the chest. Tenderness?
No.
No mass is felt. I'm going to test for chest expansion. Breathe in, out. It's symmetrical. Next, I'm going to test for tactile ephemeris. So when you feel my hands, just say 99 for me, okay?
99, 99, 99, 99, 99.
Very good. Ephemeris is equal bilaterally. Next, I'm going to percuss each lung field. Okay, our areas are resonant, no dullness heard. I'm going to test for diaphragmatic excursion, so I want you to breathe in and breathe out for me. Okay, now breathe in again, hold the inhalation. I'm going to percuss along the midclavicular line. Area of dullness is marked, you can breathe normally now. And now breathe in and out again, and hold the exhalation. So breathe in, out, hold it. Area of dullness is marked, so it measures about 4 centimeters, which is normal. You can breathe now. Okay. Now I'm going to auscultate each lung field. So feel my stethoscope, just breathe in and out for me, okay? Breathe in, out, in, out, in, out, in, out, in, out, in and 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 out. Okay, clear auscultation, no wheezes, rails, bronchitis, crackles, or rubs. Now I'm performing coughing near you. When you feel my stethoscope, just say E for me, okay?
E, 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 E.
E for auscultation, no A sound, no sound consolidation. Now same thing, when you feel my stethoscope, whisper 1, 2, 3 for me. This whisper pectoriloquy.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1,
Okay, 1, 2, 3 is barely audible in auscultation. Muffled, which is normal, no consolidation. Now I'm going to move on to the front of your chest. Just move, turn toward me. Over here. So the front of the chest is symmetrical, no redness, no rashes, no lesions, no retraction seen. Respiratory rate is normal. And now I'm going to palpate the chest. Any tenderness?
No.
Very good. No masses felt. I want you to breathe in and out. Check the expansion is symmetrical. I'm going to percuss each lung field. Okay, all areas resonant, no dullness heard. Auscultate each lung field. And breathe in, out, in, out, in and 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 out. Okay, clear auscultation. No bilaterally, no weasels, wails, bronchitis, crackles, or rubs. Okay, now you can put your shirt back on. I'll take the tray for you. We're gonna move on to the cardiac portion of the exam. I'm gonna measure your blood pressure, so I'll just get this ready. Let me get your left arm. Just have your arm straight like this. Put my stethoscope on the brachial artery. Now I'm gonna take the cup. I'm gonna take the cup. Now I'm gonna deflate the cup. Listening to the first heart sound. And then when the heart sound disappears, so blood pressure is 110/65. And now I'm gonna palpate the radial pulse. Okay, 15 seconds have passed, so heart rate is 65 and respiratory rate is 14. So now I'm going to identify all the 4 major landmarks of the heart. So on the right second intercostal space is the aortic valve. On the second left intercostal space is the pulmonic. On the fourth intercostal space is the tricuspid. On the fifth intercostal space on the left side midclavicular line is the mitral valve. So now I'm going to auscultate each heart region with a diaphragm and the bell. First with the diaphragm, aortic, pulmonic, tricuspid, and mitral. Now with the bell, aortic, pulmonic, tricuspid, and mitral. Okay, normal rate and rhythm. S1, S2 is present, and no murmurs are heard. Now I just want you to lean forward a bit. Now I'm gonna oscillate the mitral valve again while leaning forward, the diaphragm, and with the bell. Okay, regular rate and rhythm, S1, S2 is present, and no murmurs are heard. Okay, next I'm gonna put the head up at 30 degrees. About 30 degrees, and now just lay down for me, please. I'm going to inspect the neck, just raise your neck to the ceiling for a bit. So no abnormal cardiac pulsations, there's no swelling, no redness. Turn your head to the right side, please. No jugular venous ascension is seen. Okay, you can put a midline now. I'm going to palpate for the carotid pulse. Okay, so it's normal, good pulsation, 2+. Next, I'm gonna palpate each of the cardiac regions. I'm gonna palpate the aortic, pulmonic, tricuspid, and mitral. There's no heaves or thrills. I'm gonna palpate the apical pulse along the mid-asteroid line, fifth intercostal space. Okay, apical pulse is barely palpable, but compared to radial pulse, there is no pulse deficit. And now, I'm gonna also take each cardiac region, the diaphragm and the bell, aortic, pulmonic, tricuspid, mitral. Now with the bell, aortic, pulmonic, tricuspid, and the bell. Okay, very good. You can stay like that for a bit. Now moving on to the vascular portion of the exam. We'll inspect the upper and lower extremities. There's no cyanosis, there's no clubbing, and I don't see no edema in any of the extremities. Next, I'm gonna palpate each of the major pulses, starting with the brachial pulse. Okay, moving on to this side. Brachial. Okay, you can sit up for now. We're good. Palpate the radial pulse. Okay. Radial pulse. Okay. Now femoral or popliteal. Very good. Okay, just move a little backwards for me. Next, the dorsalis pedis. Now the posterior tibial. Okay, so all poses are 2+, which is normal. And next, I'm gonna have you with the bed. Just lay down for me. I'm gonna auscultate for any bruits. So first, I'm gonna auscultate the abdominal aorta for any bruits with the bell. Next is the renal arteries. And now for the femoral. Okay, so no bruits for an auscultation. Okay, so now you can, now moving on to the abdomen. So you can just lay down like that for me. And now we're gonna inspect the abdomen. So it's symmetrical, no redness, no rashes, no lesions, no abnormal aortic pulsations. It's non-protuberant, good contour. Next, now I'm gonna auscultate each quadrant. I start with the right lower quadrant. Right upper quadrant, left upper quadrant, and left lower quadrant. Okay, so normal active bowel sounds at each quadrant. And next, now I'm going to percuss each quadrant. All quadrants are tympanic, no dull is heard. Now I'm going to percuss for liver spin. The right side, midclavicularly. Areodonis is marked. I'm going to percuss again, starting from the right lower quadrant. Areodonis is marked. Liver measures around 6 centimeters, which is normal. Next, I'm going to percuss for the spleen. I'm going to start along the fifth intercostal space, along the mid-axillary line. Spleen measures about 7 centimeters, which is normal. And now I'm going to lightly palpate each quadrant. Any tenderness?
No.
Now I'm going to do deep palpation of each quadrant. No mass is felt. Any tenderness?
No.
Very good. Now I'm going to palpate the liver. So I want you to take a deep breath and hold. Take a deep breath and hold. I'm going to palpate the liver along the right upper quadrant. Liver is palpable. Okay, you can breathe normally now. I'm going to palpate the spleen along the left upper quadrant. Okay, spleen is not palpable, which is normal. I'm going to palpate the inguinal nodes, so I may just lower this for a bit. On the other side now. Any tenderness?
No.
No mass is felt. Okay, now you can sit up for me. And test for costovertebral angle tenderness, the punch test. And now I'm going to take my hand here, place it along the costovertebral angle of your right side. Now when I strike it, you tell me if you feel any pain, okay? Any pain?
No.
Good. Moving on to this side. I'm with my hand on the costovertebral angle. Gonna strike it. Any pain?
No.
Good. No tenderness, which is normal. Now we're moving on to the musculoskeletal portion of the exam. So I want you to stand. I just want you to walk back and forth 10 feet along this line. So just walk that way. And now walk back toward me. Very good. So patient has good gait, good posture. Now I'm going to spin the spine. So there is no curvature, no kyphosis, no scoliosis, and the scapula are equal length. Now I'm going to palpate the spine. Any tenderness?
No.
No mass is felt. Going to palpate the paraspinal muscles. Any tenderness?
No.
No mass is felt. Next, I'm going to assess the range of motion of your spine. So I want you to stand straight. So keep your torso straight, move to the left. Bend your spine to the left, not to the right. Very good. Go back to neutral. Keep your bend at the waist. Try to touch your toes. Then back up. And now bend your spine backwards toward me. And now back. Very good. Patient has full range of motion in the spine. Next, just want you to take a seat for me. I'm just going to inspect all the major muscle groups. So all his muscles are symmetrical, no abnormal movements or pulsations are seen, and he has good muscle tone. I'm going to inspect all the range of motion of all the major joints in your body, okay? I'm going to palpate the TMJ, any tenderness?
No.
No masses, no warmth, no fluid, no crepitus. Now I'm going to do the range of motion in the neck. So can you just take your chin, touch it to your chest, raise it to the ceiling. Very good. Now make the chin touch your shoulder, each shoulder. So start with the left, now to the right. Very good. Now make your ear touch each shoulder, like that. Now the other ear to each shoulder. So patient has full range of motion in the neck. Moving on to the shoulders, going to palpate around the clavicle, and the shoulder. Any tenderness?
No.
No warmth, no fluid, no crepitus, no masses. Now I'm going to touch the range of motion of the shoulders. So I want you to raise your arms above your head, like this. And now, again, swing them down backwards behind you. Patient has full range of motion of extension and flexion of the shoulders, okay? Now, I want you to take your arms behind your back and put them behind your back and touch each opposite shoulder, like that. And now with the other hand, touch the opposite shoulder. Patient has full range of motion of internal rotation of the shoulder. Now raise your arms above your head. Take each hand and touch the opposite the shoulder behind your back. Like that. Now the other hand. And patient has full range of motion on extension of external rotation of the shoulders. Okay, you can put them back down. Moving on to the elbows, gonna palpate the elbows. Any tenderness?
No.
No masses, no crevities, no warmth, no fluid felt. Okay, so I want you to keep your arms by your side. And I just want you to bend your elbows toward the ceiling, like this, and bend them toward the floor. Okay, patient has full range of motion on extension and flexion of the elbows. Moving on to the wrists, gonna palpate the wrists. Any tenderness?
No.
No masses, no warmth, no fluid, no crevice felt. So your wrist, extend your wrist to the ceiling, like that. And now flex your wrist down to the floor. Patient has full range of motion, extension and flexion of the wrist. Moving on to the fingers. Gonna palpate the joints of the fingers first. Any tenderness?
No.
No masses, no warmth, no nodules felt. And now I'm gonna passively move your fingers on the middle. Okay, patient has good range of motion of the fingers. Can you also make a fist for me? And then take each finger, touch each thumb, like this. Very good. So patient has full range of motion of the fingers, and one other thing, can you just put your arms right here, put them right at the table, and then rotate the wrists, or flip over the wrists back and forth. So patient has full range of motion of the wrists and fingers. Now moving on to the hips. Gonna inspect the hips first. There's no major leg length discrepancies. Gonna palpate the hips. Any tenderness?
No.
No warmth, no fluid, and no masses or crepitus felt. So just stand for me. Gonna test for extension of the hips. So face toward me, and just extend each leg behind you toward your glute behind you, yes. And the other one. Very good. So good full range of motion on extension of the hips. Now lay down for me. So do flexion of your hips first. Now bend each elbow. Bend the elbow. Bend the knee, sorry. And then use your arms to bring it toward your chest. Okay. Very good. Now the other leg. So patient has good range of motion, full range of motion on flexion of the hips. Now we're going to do internal and external rotation. I'm gonna do this for you. I'm gonna put the knee and the thigh at 90 degrees and do internal rotation, external. Now the other leg. And then bend the knee and the thigh at 90 degrees. I'm gonna do internal and external. So patient has full range of motion on internal and external rotation of the hips. Next I'm gonna take your leg, gonna perform abduction and adduction of the hips. On the other leg, I'm gonna take your leg, adduction and adduction. So patient has full range of motion on adduction and abduction of the hips. Now you just sit up for me, please. Okay, now I'm gonna palpate the knees. Any tenderness?
No.
No masses, no crepitus, no warmth, no fluid felt. Now I want you to extend each knee toward the ceiling. Extend it. Now the other one. Very good. Patient has full range of motion on extension and flexion of the knees. Now just sit back a little bit for me. Moving up to the ankles. I'm gonna palpate the ankles. Any tenderness?
No.
No masses, no warmth, no fluid, no crepitus felt. Now can you do some ankle circles for me? Very good. Patient has full range of motion of the ankles. Next, I'm going to move on to the feet. I'm going to palpate the toes, all the major joints. Any tenderness?
No.
No masses, no fluid, no nodules felt, no crepitus. Now I want you to, can you raise your feet toward the ceiling or toward you? Yes. Now, back that way toward the floor. Try to touch the floor. Very good. So dorsiflexion and plantar flexion, full range of motion. And now can you just keep your legs straight, turn your heels inward, like that, and then now outward. Very good. So patient has full range of motion of the feet. Okay, now sit for me. I'm gonna do a small mental status exam on you. So can you tell me your name and date of birth?
Alain Ringel, 10/12/1995.
And can you tell me where you are right now?
Brooklyn.
And can you tell me who's the current president?
Joe Biden.
The patient is oriented to person, place, and time. And now I can repeat 3 words to you. Can you repeat it back to me? I'm going to say these 3 words. Repeat it back to me. Car, basketball, rose.
Car, basketball, rose.
Okay, very good. Can you tell me what you ate for dinner last night?
Chicken.
And then can you count backwards from 100 to me, subtracting 7 each time? For example, 100, 93, and so on.
So 100, 93, 86, 79.
Okay, so very good. And can you repeat the 3 words I said previously to you?
Car, basketball, rose.
So patient's mental status exam, good recall, and his speech is clear and fluent. Okay, now moving on to the motor part of the examination. So I want you to just stand for me. I'm going to do pronator drift. So I want you to close your eyes and then raise your arms out in front of you like this. So close your eyes, palms facing the ceiling, and just stay still for me. Okay, so there's no unilateral drift. The forearms are not turning toward the floor. Very good. So that's negative. And now I'm going to sit down. Now I'm going to test all the muscle strength of all the major muscle groups. So first we're going to do the TNJ, which is cranial nerve number 5, trigeminal, the motor part of the cranial nerve. So I want you to clench your teeth. And now I'm going to just resist for me trying to open it, okay? Okay, 5 out of 5 strength there. The cranial nerve number 5 motor part is intact. Now I'm going to do the neck. So I want you to try to push my hand, rotate your neck that way, and now this way. And then I want you to raise your chin to the ceiling. Now raise your chin to the floor. Very good. 5 out of 5 strength of the neck. Moving on to the shoulders. Testing. This is also going to test cranial nerve number 11, spinal accessory. So I want you to raise your shoulders against my hands toward the ceiling. Very good. So 5 out of 5 strength right there. And cranial nerve number 11 is intact. Moving on to the elbows. So curl like this. I want you to raise your elbows toward the ceiling. Pretend you're curling. And now backwards for me. Okay, 5 out of 5 strength there as well. Going on to the wrists. So I want you to move your wrist toward the ceiling. And now toward the floor. Flex them. Very good. 5 out of 5 strength there too. Moving on to the fingers. I want you to raise your finger against my finger. Okay. And now move your fingers down toward my one finger at a time. Very good. So 5 out of 5 strength of the fingers as well. Now moving on to the hips. So can you just lay down for me again? Okay, so try to raise your leg against my hand. And good. And keep your leg straight. The other one. Very good. Now I'm gonna raise this. Try to raise your leg straight. Keep your leg straight. Try to raise it down against my hand. Very good. Now this one. Okay. And now try to push my hand with your leg, keeping it straight. Push it toward me. And one more time. Very good. 5 out of 5 strength of the hips. You can sit for me now. For the knees, so I want you to. Okay, so raise your knees toward the ceiling. Okay. And now try to move your knees backwards toward my hands. Very good. 5 strength of the knees. Just move backwards a little bit for me. Now moving on to the feet. Now I want you to raise your feet toward you. Very good. And now try toward the floor. So 5 out of 5 strength of the feet. So 5 out of strength of all the major muscle groups. Now I'm going to move to the sensory part of the exam. So feet forward. I'm going to test cranial limb number 5, trigeminal, the sensory portion. Close your eyes, and you're going to tell me if you feel the sensation, okay? Where do you feel it?
Oh, my forehead, my cheek, the other cheek, my chin.
Very good. So cranial limb number 5, trigeminal sensory portion is intact. Now keep your eyes closed. Now you can tell me what sensation you feel and where you feel it, okay? Just give me 1 second and get my tool. Okay, first right here.
Feel pain in my right arm. Pain in my left arm. Pain in my right leg. Pain in my left leg.
Okay, very good. Now I'll tell you what sensation you feel.
Feel a light touch in my right arm. A light touch in my left arm. A light touch in my right leg. A light touch in my left leg.
Very good.
Feel a dull touch in my right arm. A dull touch in my left arm. A dull touch in my right leg. A dull touch in my left leg.
Okay, one more.
Feel vibration in my right arm.
No.
No. Sharp
Yes.
touch on my right arm.
Yeah. Don't worry.
Sharp touch on my left arm. A sharp touch on my right leg. Sharp touch on my left leg.
Okay, let's close more.
Feel vibration in my right arm. Vibration in my left arm. Vibration in my right leg. Vibration in my left leg.
Very good. And now I'm going to give you an object in your hand, and you're going to tell me what object it is. Close your palm, close your hand.
It's a coin.
Okay. Now this one.
It's a pen.
Okay, so sensory exam is intact. He's able to feel all sensations, and stereognosis is also intact. Now moving on to the balance and coordination. Can you just take a step? So I want you to walk heel to toe this way toward that way. So patient is walking heel to toe. He has good gait, on balance, not staggering, not walk on your toes. Very good. Now walk on your heels the opposite way. Again, patient has good balance, he's not staggering, not falling. Now take a seat from me. Now I'm going to do finger to nose movements. So take your finger, touch my finger, and then touch your nose as fast as you can. Okay, so his movements are controlled and smooth. And next, can you just lay down for me? Okay, now I want you to take this heel and put it on the opposite knee. And move your heel down toward your leg, toward your shin in a straight line. Very good. Now do it with the other one. Heel on the opposite knee. And move it in a straight line toward your shin. So patient is able to move each heel down his leg toward the shin in a straight line. Now sit up with me. Now we'll do romper text. I want you to sit by the bed. Sit, stand by the bed. Sorry, stand up. Stand by the bed, but don't touch it. Keep your feet together, arms by the side, close your eyes, and just stay still. And I got you. Okay, so patient is not swaying. He has good balance. So Romberg is negative, okay? You can take a seat now. Now I'm going to test all the major tendon reflexes. So now we're going to test for the bicep tendon. Good. Now the other one. So bicep tendon reflexes are 2+. Next for the tricep. Very good. Now the other one. Very good. Tricep tendon reflexes 2+. Next to brachioradialis. Good. Brachioradialis 2+. Next to the quadricep patellar. I'm going to strike below your kneecap. Very good. Again on the other leg. Quadricep patellar tendon reflex 2+ as well. And now I'm going to do the Achilles tendon reflex. Going to dorsiflex the foot. Very good. And now the other one. Very good. And Achilles tendon reflex 2+ as well. And now just move a little more backwards. Levinsky now. I'm going to make a J shape along his foot toward his toes. And again, so his toes are curling, which is normal, and toes are not curling outward, so there's no sign of any neurological impairment. Now you can take a seat from me now. So that concludes the head to toe examination. Everything looks good. Thank you and have a nice day.